Welcome to the Illinois Primary Healthcare Association's Health Talks podcast. On this podcast, we highlight incredible individuals who advance community healthcare, advocacy, and public health while striving to improve patient care. I'm Stacy Agosto with IPHCA, and I lead technical assistance for our great Illinois health centers on all things behavioral health and substance use treatment integration. I'm very excited to host our guest today, Dr. Maria Rahmandar. Dr. Rahmandar is an attending physician in the Division of Adolescent and Young Adult Medicine at Lurie Children's. She's the medical director of the Substance Use and Prevention Program and an associate professor of pediatrics at Northwestern's Feinberg School of Medicine, with a secondary appointment in psychiatry and behavioral sciences. She is board certified in pediatrics and adolescent medicine. So basically a powerhouse physician that has generously given her time to us today. She'll be hosting a webinar for us and you all and anyone who can join us addressing substance use in teens and adolescents soon. Depending on when you're listening to this episode, you may be able to catch that live or on demand on our website, so make sure to check that out. Again, we're very privileged and excited to have Dr. Rahmandar today. Dr. Rahmandar, thank you so much for joining.
Thanks for having me, Stacy. Excited to talk again.
Yeah, me too. And so before we get into it, the question on all of our minds in Chicago in February is, how are you enjoying the winter?
Well, we had our false spring, which was
Yes.
great. Got outside, found a snow tip to my cross-country ski pole that I had lost in the snowdrift. And so, yeah, it's been great. But now winter's back again. So,
Oh my gosh, I'm so shocked. I just stepped out to get a coffee and I'm just shocked at how cold it is again. We're never out of it, but hey. Well, I'm again so thankful that you're here to talk to us again today. We want to talk more about adolescent substance use. I think for a few reasons: to destigmatize it, make it less intimidating and scary for our providers and teams. And especially, I think the ages of patients can be intimidating, maybe working with families. So would really love your guidance on some of these things. Maybe we can start with, what are you seeing? Are there any trends you're seeing in teen substance use now? Is there any difference from what you have seen, and has that changed in recent times?
yeah, teen substance use certainly is changing. Fortunately, overall, substance use has gone down since it peaked in the 90s. But, the things that we are still seeing is vaping, nicotine. Fortunately, that has seemed to go down in the past couple years, but still a significant portion of adolescents are vaping nicotine. Cannabis use is still going strong, and at the same time, the concentration of THC, the psychoactive component of cannabis, has increased in the plants over time. And then we have these super concentrated products of, oils and waxes and, that people use in different devices and vapes. So the type of cannabis that adolescents are using is changing too. And then, of course, we have fentanyl that is sadly, taken far too many lives. But the interesting piece of that is that in my clinic, I see less youth injecting. And, which may be because fentanyl is so potent that you're just getting the effect you would get if you injected heroin, but with fentanyl, you just snort it and you get a similar.
Okay. So the overall highlight, which, not to blow past that, is that overall teen substance use is going down since the 90s.
Yeah. So, most teens are making healthy decisions not to use. And so I think it's not all doom and gloom or inevitable, the feeling that all kids are going to do it. So what's the point of intervening? It's not true. So, there is value in talking to youth and helping prevent substance use, because the adolescent years are the time when people who end up having substance use disorders started using.
Yes, absolutely. And I know that from working with adults, absolutely. So last time you and I talked, and for listeners, you can find that episode on our website. I think that we spent a lot of time talking about vaping and cannabis. So I appreciate you highlighting that for us and for providers and teams to make sure that screening for those things and educating teens on that is on your radar. Speaking of screening, any effective screening tools or any go-tos that you have?
There are a couple validated screening tools that have exist for the adolescent age group. And so probably the most broadly used is the craft, or the one that it screens for past year substance use and follows up with risky use or problems related to use. So using in the car, to relax alone, friends or family being upset with you. Have you gotten in trouble? And have you ever tried to cut back but couldn't? And that is a pretty common one. And so a lot of primary care docs are aware of that. There are a couple others like the brief screener for tobacco, alcohol, and other drugs, and the screening to brief intervention or S2BI. And so all of those are great options. And I think it's nice to, if there's something already built into your electronic medical record, that can be a
Right.
place to start. And it's great to, nice to have some idea of what substance use is even before folks, come into your office, and so that you can just get straight to addressing it without necessarily having to, spend the valuable and limited time asking all the questions.
Right. Right. That's very helpful. So as you're working with teens, adolescents, I think again it can be some providers and teams have a really easy time working with this population. They just have kind of that just an ease in working with certain age groups, but other people find teens to be kind of intimidating like we were talking about earlier. So how do you build trust with folks as they're coming in?
Yeah, this is, of course, something that can happen over time. And, not everybody is going to be totally forthcoming on the first visit.
Mhm.
And just knowing that that's okay, because especially in the outpatient or primary care setting, this is something that you can, chip away at over time and really kind of develop relationships and rapport. But I like to start off with, having time alone with adolescents every visit, not just for ones where, they're coming in for birth control. So we'll talk. But because sometimes there may be something going on, but their parent might know that they're sick. So they're going to bring them in for, strep test. But what's really going on is they are having some other issues. So
Mhm.
I like to just kind of normalize that time, and it can be super quick some visits, and other times it'll be longer. And like to set the stage of, that what we talk about can be private unless I'm worried about your safety. And I like to do this with everyone each visit. So that can be nice to just, and also sometimes when people are talking about are getting it seem to be nervous, or we're talking about pretty sensitive stuff, I let people know how I can keep this information private, like in the chart, especially if I'm typing a little bit as we're talking, but I might take a break from typing too, just so that it's person to person. And I like to start off by understanding why somebody uses drugs or alcohol, and to kind of see what they get from it, and not just, making assumptions about the reasons, and then understanding their goals around use and letting them drive that rather than it being a lecture, but that I really care about the reasons behind what they're doing. And also caring about them as a whole person. So not just like, you know, addressing their substance use, but like what other things are going on, their mental health and their reproductive health. And yeah, I think youth appreciate that, and often are not interested in coming to a visit that's strictly about substance use.
Oh, of course, right. And as you're talking, it's just all the same things that we would train folks on treating and speaking to adults with substance use or
Hmm.
any other kind of medical or primary care concern that they're coming in with. And I appreciate, not taking the pressure off that the trust is obviously not going to be built immediately all the time. And there are ways that you can normalize the alone time. And I think we've done some trainings and discussions around things like intimate partner violence for all populations, or meaning all ages, it's very similar that you might say, I this can be kept private unless I'm worried about your safety, and I spend time alone with each patient. This is just a normal part of our work. It can be as simple as that. So that's great. I appreciate that. When do you bring in, and I know that this answer could be different depending on what you're seeing, but at what points, just what comes to your mind, when do you bring in parents or family?
Certainly, if the family brings up a concern,
Yeah.
I always, no matter what somebody's coming in for, if they're here with a family member or a loved one, I like to get them in the room first to just get their perspective on things and hear their concerns. And then, circle back to them at the end. I think that helps them feel comfortable leaving a room as well. Just saying, hey, I like to have a little bit of time alone with each patient, but I'll bring you back in for us to talk about the plan. And, it is the when to break confidentiality is certainly, it's not black and white. It's
Mhm.
sometimes it feels like it can feel pretty clear, but it is certainly nuanced. And I think some things to consider would be the more immediate or the more recent the concern, the more, immediate the need to bring in family, you know, n- discussing with the youth when you think that's important, reminding, reflecting back to that, if I was concerned about your safety, I said, we might have to talk to some other folks. And I think it would be important for your parents to know this thing.
Yes.
What is it? Like, that you were in the ER for an overdose, like that
Right.
might be something important and we can like figure it out. And like, what are the details that are really important to the youth to keep private? Like maybe they don't want their family to know whose house they were at when it happened, or, what friends they've been hanging out with, or, what is it? And you can decide like, are those details medically critical to share versus, what are the things they can still have power over? And it kind of makes that a little bit easier. And we are actually part of this multi-site study looking at just engaging parents more routinely around substance use without breaking confidentiality when it doesn't need to be broken, but asking, like screening parents for their concerns around their use substance use and what values they have around substance use and trying to like just facilitate general conversations about like hopes for their kids and their substance use and then the kids values around substance use in like just an open conversation kind of a way without necessarily bringing up specific substance use concerns, so just kind of like keeping the door open for conversations with families. So that's been an interesting project that we'll see. We'll
Yeah.
see if we want to share that more broadly.
Yeah, yeah. And I just want to highlight kind of the skill and probably years of honing your own way of working with patients to kind of hold both the respect of the parent and family and the respect of the teen patient. And I love, talking about, or what you said about breaking confidentiality, meaning, there are going to be some things that you want to share for the safety, but then being discreet about what details that you share even with the parent.
Hmm.
Yeah. Yeah. That's super helpful. So let's change gears just a little bit to talk about some things that potentially you're seeing more of lately. And I think this is just coming up a little more in our culture. A lot more knowledge and questions around things like ADHD, attention, and prescribing of stimulants. And so, what do you just broadly think the risks and benefits are of prescribing stimulants to adolescents, or things providers should be aware of?
Yeah, I this is can be a tricky situation and not always super clear, but I think coming to every patient encounter with compassion and not an openness and not an assumption of drug seeking or things like that can really help understand and be able to dive deeper into what the concerns are. So when I have a patient who's coming in with an attention concern and has substance use, it can be hard to like tease them apart. And, some things that are helpful to understand are when did attention concerns start? And getting information from the youth, from the family, from school, and kind of seeing how they're noticing that in different settings. And sometimes these certainly people have ADHD and have substance use, and they can both create attention concerns and they can both occur together. So I would still argue and that like that treating can make a difference because we see that there is some evidence that treating ADHD may decrease substance use.
Yeah.
And certainly we don't have data to say that treating like true ADHD increases future substance use. I think, and there's some kind of safeguards around stimulant use that we can discuss too with families. I also like to know, how long, how has attention changed with substance use? And, has there been a period of prolonged abstinence? And how has attention been impacted by that?
Hmm.
And, stimulants certainly are first line treatment for ADHD and probably the most effective treatment that we have, but it's not the only treatment. There's certainly behavioral changes, that can happen around structure and organizing your life and, avoiding distractions that can be helpful. There's other non-stimulant medications that can be tried. And so it's not the end all and be all, but I think it is a very reasonable thing when somebody comes to you with ADHD. And so, engaging families in holding the medication, locking it up,
Hmm.
giving single, doses out can be ways to avoid diversion. And also, long acting ones that can't be snorted, may be a way to avoid some diversion too. So some strategies that can be used to,
Right.
for folks that are afraid.
Yes, right. So, not shutting it down immediately or making assumptions, screening, of course, getting collateral information, seeing what may help, comparing, and then, also being cautious in terms of probably harm reduction strategies, locking up meds if we have to, behavioral strategies. That's helpful. When
Yeah.
we're looking at OUD, so we talked a little bit about ADHD and stimulants. OUD, for those listening, opioid use disorder. I think we've done so much education and spent a lot of time. IPHCA has, and I know many providers in the state educating around treatment of OUD, and we're pretty well established for adults. Is there anything that you would say would be any unique barriers or, again, things to consider when implementing for adolescents?
Yeah, it's so important that we have all these life-saving tools, including medications for opioid use disorder available to youth that are using opioids. And studies show that youth are not accessing these
Hmm.
medications, and that is really concerning. I think a couple things get get in the way of that, and that includes, buprenorphine is FDA approved for 16 and older. It would be something to consider using in younger youth using opioids, and certainly, many providers have done that. And but there, that is one that would be wonderful if it was more broadly available. But I think there's still a good amount of fear and stigma around prescribing buprenorphine. Pediatric providers are still not used to that, and the waiver that used to exist that you
Hmm.
had to get, making this medication different than every other medication, we still, even though that doesn't exist, I don't think we've shaken the stigma around it. Vivitrol and methadone are, excuse me, naltrexone, and methadone are certainly also options to consider off-label in folks under 18, but it's tricky to get youth engaged in methadone treatment, or federal regulations have loosened, but I don't know that that's really trickled down to increasing access or availability to youth yet for that.
Yeah.
So, but it's so rewarding. So, like, when you see youth coming in with opioid use disorder and just like in horrific withdrawal and feeling terrible and at the lowest point, and then you see them back and they are like feeling like themselves and engaging in life again. It's amazing.
Yes. Yes. So I'm hearing, similar again to some of the barriers we have with adults, but maybe more so in terms of just uptake of the medication and some provider fears, or maybe some needing some education or more information around the availability of the meds or the effectiveness. But when people are able to get access to them, of course, treatment is available, recovery is possible. Yeah, yeah. So thank you for that. I think I wanted to talk a little bit about, just in your experience, speaking of treatment, are there any kind of go-to harm reduction strategies or even strategies in general for treatment that you feel are most effective for adolescents?
Yeah, a lot of adolescents are being dragged in by their family. You
Right.
know, they're sometimes at the beginning, their motivation to make changes around substance use is pretty minimal. And so understanding what their goals are, because there's likely something that they're wanting to work on, whether that's depression, anxiety, relationships that have been, you know, harmed, and kind of understanding things that they want to focus on and starting there can be helpful. Well, over time, seeing how that substance use might be impacting those goals or getting in the way of them, making those things better in their life. And, other harm reduction strategies that we talk about would be, not using alone, avoiding mixing substances. Sometimes teens are interested in, might want to work on one substance while not addressing another substance yet. And so I think rolling with that motivation and helping reduce some substance use while not ignoring the other one, but like, getting control over one can make a difference, and also build that rapport and trust, and that you care about what they're looking for. And then, teaching everybody how to reverse an overdose so that, lives can be saved.
Yes. Yeah. And that reminds me of someone that I recently working with who started by eliminating cocaine use, and then felt motivated, felt really kind of just supported, and was able to then reduce and stop alcohol use. And now we're talking about nicotine, which is wild. This is somebody who was earlier saying that they would never be able to quit smoking. And so to see the progress and build on other success is very, very cool.
It's so great. And I have a lot of teens that are, if you said I require abstinence from everything on day one, they'd be like, see ya,
Right.
not coming back.
Right.
And so of course, and if there is a teen who's like, I want to stop everything, I'm not like, no, we only do it
Yeah.
one at a time.
Yeah. Right.
Or like, yeah, absolutely, let's stop it all. But really, just working with people, you see how amazing that is, that like, right, something that they thought they would never stop. See like how life can get better and better with less substance use. It's
Right.
awesome.
Right. Yeah. This has been so wonderful, and we love having you on just to share your experience and all of your knowledge with us. As we close out here, what do you think, would you say, is the best part of your work?
It is so great seeing how resilient teens are, and that they can really make some amazing changes in their lives and bounce back from some pretty dark times. And at the same time, there is still hope at any age for recovery and positive changes in life, and it can be a tricky part, but a really important part of working with teens is engaging parents and like reminding parents that they still have power
Mhm.
and that relationships can be repaired. It's really fun to work with this group. So I encourage others to too.
Yeah, yeah, this is great. And hopefully people listening feel a little more comfortable, a little more inspired. Your patients are very lucky to have you. And we in the state of Illinois and great city of Chicago are also very lucky to have you. So thank you so much for being on today. And we will close out to our listeners. Hope you enjoyed this episode, and please join us for future episodes of IPHCA's Health Talks podcast. If you enjoyed today's episode, don't forget to like and subscribe on your preferred platform. It helps us reach more listeners and create more content like this.